Common injury in tennis and again all racket sports, any running sports, is the Achilles. The Achilles tendon can be the bane of many people's existence, especially runners. It can be extremely difficult to rehabilitate. It's pretty far from the heart. You don't get a ton of blood flow to the tendon, and tendons can take quite a long time. So there's a couple different types of Achilles issues. There's that acute tendonitis, and then there's more of that persistent tendinopathy or tendonosis. So we're going to kind of cover both of those today. So again, assuming that we've assessed the entire body, how the foot's moving, how the hip's moving, knees moving, etc., on why that tendon, it keeps getting beaten up, first we need to do that. But we're just going to, for the sake of video, we're just going to target the Achilles and how we treat that. So the first thing we need to do is kind of strip out or relax this posterior chain, the calf muscle and the hamstring. Oftentimes there's a lot of research on this, but like if you're having a tendon problem in the Achilles here, the gastrocs, the soleus, this whole muscular structure here is insanely tight. So we need to get that relaxed and we need to get it stronger as well. So we can do that with various soft tissue techniques in through here, massage therapy. Another effective tool is, again, shockwave. Shockwave is extremely helpful for tendon and muscle problems. I'm not going to turn it on right now, but essentially we put some gel in there and then we'd run it through the Achilles tendon here. And then sometimes I'll run it up and through the gastrocs as well, just to help get things to settle down, break up any scar tissue adhesions, etc. Then we're going to also, we can mobilize the ankle. So kind of down and through like this. Extremely tight. And I've had some patients with years and years of pain, and simply doing these couple maneuvers can take that pain away. It's quite it's really remarkable for some people. Oftentimes if there's an Achilles or ankle problem, this toe is not going to move either, and we got to make sure that toe moves at least 40 to 60 degrees with a little bit of pressure there, and hers moves fine. But if it doesn't, we can just give a little tug, and we need to loosen up the muscles in the bottom of the foot here, kind of like a massage, if you will. You can get the roller at home and massage that, just to help get that toe movement. If that's not moving enough, it's going to cause excessive strain and tension in through the Achilles, so that may be one reason you're having that issue. Another tool that we often use to help alleviate Achilles tendon pain and other tendon issues is acupuncture. So I'm not going to take them out now, but we essentially throw these in through the, not right into the tendon, but right around the tendon and up and through the muscle belly here, just to alleviate that tension, alleviate that pain. And that's going to help us create a window of opportunity where we can actually rehabilitate it, because the pain is going to be a lot less, so we can actually start doing some strength training. So let's get to that. So to combat an Achilles problem, again, we need to do the hands-on care to reduce the pain, get things moving again. But then we really got to focus on the rehab. We want to do two things. We want to get the muscles loose and limber, but then we also want to get them stronger and tension those and stress those structures so it can actually heal appropriately. So a couple different ways to stretch is we're just going to have your hands on the wall there and then bring that leg backwards. So the effective leg backwards and try to get that heel on the ground. And then you should feel a really good tug in through there. If you don't, just kind of shift your hips forward a little bit, keeping that heel down. And again, you should feel a good gentle pull in through here. It shouldn't hurt. If it does, you need to stop. Okay, so most people can't do this, but you're really flexible. And then you're just going to get your one foot kind of behind like that. And then try to keep that leg straight though. There you go. And I find this to be really effective to help stretch this posterior calf in through here. So after we've stretched everything, then we need to strengthen it. So the way we can strengthen the calf is by doing essentially heel raises. So we can just go up and down on your toes. So just turn around here. It's just looking at the feet here. Just turn around, just hold the wall. So you can hold the wall. And you're just going to go up on your toes and then slowly come on down. Yep, and then do that again. You're going to do this about 10, 20, 30 times or so. And if that's quite easy, then you can do that on just the affected leg. So just bend one knee and do it on the injured leg. Again, this shouldn't be painful, but there can be some discomfort. Obviously, you can throw some weight on there. If you're at the gym, put something on your shoulders just to add a little bit more weight.